I'm Dr. Mehdi Hassan Ansari. I'm a specialist orthopedic spine surgeon. After completing my orthopedic residency from India, I was trained in spine surgery from India, USA, and Singapore. And I'm a practicing spine surgeon for the last 10 years. And I'm here at NMC Specialty Al Nahda for the past 3 years. I generally deal with patients with spinal problems, and we are routinely in contact with the doctors from Nigeria and other African countries, and help them and guide them in the treatment of their patients. Sometimes, there are some patients who require specialized intervention or specialist care, for which we have to call them here. And in general, we see about 3 to 4 patients coming to our hospital from Nigeria in a month or so. I think arthritis, and especially spinal arthritis and stenosis, degenerative disc problems, these are very common. These are common everywhere, but yeah, of course in Nigeria it is pretty high. And these are conditions which require specialized care, and with the advancements in spine surgery and minimally invasive interventions, these can be taken care of very effectively, and patients do have very good results. They go back home, they go back to their job very early. So yes, I mean, we do see them very frequently here, and we have all the specialized care that can help the patient deal with this problem.
Well, I started experiencing pains when I stand for a long time. For over a year now, past 1 year, if I stand for maybe like 15-20 minutes, I feel pain in my waist. I just felt that it's just normal pain, maybe. So the last 3 months, it got severe to the extent that I couldn't bend. If I stand for just 3-4 minutes, my legs started getting numb. So I started using a walking stick to support myself before I could walk. Sometimes getting up from the bed is really difficult. I started feeling sharp pains in my waist. To turn while sleeping, I can't even turn. So I went to the hospital. When I got to the hospital, I was advised to do an MRI test. So the MRI test now revealed that there's a bulging disc in my back. So I needed a spine surgery.
Mr. DK came to us from Nigeria. We have an international patient care team that takes care, that is the first point of contact for all our international patients. I was given the reports of his MRI reports, his X-ray reports, the symptoms that he has been having, the medical treatment that he has undergone for the last 3 to 4 months. And he was suffering a lot. He had severe back pain with leg pain, difficulty in standing, walking. I mean, he could not even lie down in bed. He had disturbed sleep due to pain. So looking at his symptoms, his conditions, his MRI reports, we decided that he requires an intervention. We call it as microdecompression. And for that, we called him here. And yes, our international patient care takes care of all the transition, the commute, the airport transfers, the hotel arrangements. And once the patient is here, we saw him in OPD, examined him thoroughly, and came to a management plan. We plan to do a surgery, which is a minimally invasive spine surgery, an L2-3 micro decompression. It's a routine thing. It's for us. I mean, we do it. Routinely here. It's a surgery in which you have a small cut, maybe about 1 or 2 centimeters, through which we put a tube. And with the help of the tube and the microscope, we decompress the nerves that are compressed in the spine. And the patient is walking 6 to 8 hours after the surgery, and next day he can go back home. So Mr. DK also underwent the same surgery, and he is very happy with the surgery. He has done pretty well. And yes, we are planning for discharge today, and he's even planned his shopping list and stuff. So yes, he's very happy.
Then, the spine surgery, thinking of something to do with the spine is something that is so delicate. I couldn't imagine myself that if any slightest mistake that is done in the process could keep somebody on the wheelchair for the rest of his life. So I was advised by some friends, and we decided, I agreed with my wife, that we should look for a hospital, probably in Dubai, because we used to see a lot of advert of Dubai medical facilities. So I went on the internet and just searched for some hospitals, and I just saw this NMC and sent the request dialogue in the site. I typed my name and the symptoms. Not up to 2 hours, I received a call. This is Dr. Batia. You sent a request. We'll look at the analysis and all that. So she asked me to send the detail of the report. I sent a soft copy of the MRI report. So she now asked if I have the CD, if I could upload the CD. I sent the CD. Not the next 2 days, said they were going to do the analysis and see what will be done. So she sent back the analysis and the cost of the surgery and all that, and I was okay with it. So I now asked if I could be scheduled for an appointment. She said the next week I could be scheduled for. In fact, she said even in the next 2 days I could get the appointment, because of the process of travel, documentation, visa, and getting the money for travel. So we shifted it for the next 5 days. The next 5 days, because we were doing all this arrangement. I sent the request on a Sunday. The same Sunday we got the feedback. By Monday, she had sent me the analysis and said, Dr. Mahdi. Then I now asked, how good is the place? She said, that their success rate is 99%. That gave me some confidence. So by the time we analyzed the request, so we decided to travel down here. Got the visa, we got the request, the appointment letter from the clinic. So getting the visa wasn't difficult. UAE visa, you could just apply within 48 days. So we actually got a tourist visa, not even a medical visa. Because if we got a medical visa, we will need a doctor's fitness report before flying. So we got to the airport. All the while I was working with the support of the walking stick. But because Dubai airport is big, there's no way I could get from the arrival to where we'll get our luggage. So arrangement was made with the Emirates. They got me a wheelchair. So also a good experience that the clinic sent a cab to pick us from the airport, which they took us to as we arrived that early, they took us to the hotel, then back to the clinic around 10 a.m. So the checks were done, did some tests, blood tests, X-ray. I think was the ECG done that day.
Yeah.
ECG and all that. So, and the test results were okay that I was fit. Then the next day, I was scheduled for the surgery.
With the advent of minimally invasive spine surgery and the newer techniques and neuromonitoring, that we have today, the complication rates are much less than we had maybe probably 10 to 15 years ago. And nowadays, spine surgery is a specialized branch. So we have people who are thoroughly trained to do only spine surgeries. So yes, the complication rates, if you ask previously, they were higher, but nowadays with specialized intervention and care, the complication rates are very less. Most of the patients, they are walking within 6 to 8 hours of surgery. Next day they are going back home, and within a period of week to 10 days they are even going back to their jobs. So that is pretty good. Only 5 to 10% of people with spinal pain actually require surgery. So and most of the people can be taken care of with good conservative care in the form of physiotherapy, rehabilitation. There are a few which require surgery, But even if surgery is required, there is nothing to be afraid of. Okay, I mean, most people do have very good results. Okay, the only problem is that people, because they are frightened, they tend to delay their symptoms, delay in taking medical care, specialist opinion. Okay, and that is when the problem starts to arise. Okay, so if the patients don't delay their symptoms, they take proper opinions, okay, at appropriate time, the outcomes of spine surgeries are very good.
Meanwhile, as we arrived at the clinic, I couldn't stand. I was being moved around in a wheelchair because I couldn't walk. So the next Thursday, I was scheduled for the surgery. Surgery was done on Thursday. Same day I got consciousness, and immediately as I woke up, my toes, I couldn't move these toes because there were no reflexes on this leg anymore. So then I started moving. You can see that I'm moving I can move the toes now. I can lift the leg up, even sitting down. I can lift. You can see that I can lift this. Because there's something that was put on my leg to massage the leg. I couldn't get up that day. Then the next day, on Friday morning, Dr. Omiadi came and removed the straps on my leg and asked me to stand up. And I stood up without pain. All the pains gone. He asked me if I could walk, and I started walking the next day. So that was it. So he advised that I should be putting on the belt for the bones to stabilize. So since then, I've not felt any pain, and the healing was so instant. It's not something I could even imagine that I could just get the results.
We are always here to help our doctors and patients through whatever means possible. So now low back pain is a pretty common problem, and most of our physicians and clinicians do deal with back pain very frequently. More than 60 to 70% of the patients that any orthopedic surgeon sees in his OPD, okay, do have back pain. So, and more often than not, these patients can be taken care of with conservative means. But there are certain signs and symptoms, like if the back pain is accompanied with numbness or weakness in the leg, or there is difficulty in standing, walking, there are claudications, or there is such severe pain that the patient cannot be taken care of with medications and physiotherapy, then in those cases, okay, they do require MRI investigation, and they do need to take the second opinion. So we are available here. Okay, we are available all the way around. I mean, we have this international patient care, and they do send us mails, and they can WhatsApp. Now things have become pretty easy, and we do give them second opinions here on the ways they can deal with their patients. And of course, if there are some patients who require specialized intervention or something, we can arrange managing these patients here at NMC Specialty also.
My wife also was so surprised, and we did a video and sent to my children in Nigeria, and they were so excited because it was 3 months of horrible, and I can't even describe the pain. If you say excruciating is understatement. I couldn't do anything for myself. I couldn't walk. So it was just, I was just demobilized completely. If I sit for a long time, getting up is a problem. If I have to walk from here to that door, I will have to rest, walk a bit, sit down and rest. Meanwhile, I have to also support myself with the stick. But now I can stand up, I can walk, so I'm fine.
When he started, it wasn't easy, as he said. I knew he had pains, excruciating pains, but I won't be able to feel, he's someone that wakes very early in the morning. With any slight noise, he's up. I discovered he doesn't get up from bed early. He feels reluctant. I knew he was going through pains. but I didn't know the degree or how deep, but I knew something wrong was going on, you know. So when we got the information about coming here, when we got the information that I had to go through surgery, it wasn't easy because I had a lot of fear, a lot of worry if it was going to go right, if there was going to be any mistake, how it will be done, how will it look like, you know. But when we decided that we should come down here to do it, we got all the information, we were satisfied, we had peace. We believe that once we get here and the procedure is done, you'll be fine. We believed it. You know, before we got here, we already got information that it was good. And he had very high success rates. So that didn't put fear in us. And when we got there, we met him in his room. He took time and explained everything. So he made it very easy. We had a picture image in our head of what he was going to do. And he made us comfortable, made us know that it's not something that is going to be difficult for him and to be easy. So we had already had the picture in our head, so we didn't have no worry.
The explanation of the process he made, actually simplified it. Yes. He made it so simple because there was illustration of even the spine models on his table.
Illustrated it.
So he illustrated
what he was going to do.
This is, he reviewed the video with us, showed us the video, the CD, and this is the point where he's going to take out, and this is the reason why he's causing this pain and all that. So that explanation alone, and the atmosphere also, the atmosphere of the hospital is quite encouraging. And if you talk of maybe relating with having confidence in another nationality, Nigerians were used to traveling to India for medical attention. So when we saw he's an Indian person, we already had the confidence. I was discussing with my wife, because not to excite you, Indians were quite good in science. In my secondary school days, we had a lot of Indians. All the science subjects were taught by Indians. So that also, gave us confidence.
We already have connection with Indians from home before coming here.
What I would advise people who suffer back pain should not just be seen as ordinary back pain. It could be something deeper than that. Because I'm sure when I started experiencing these, symptoms of pains, if I had, sought a deeper opinion, or maybe seen a doctor or a neurologist, because I didn't see a neurologist actually. When the initial contact I was making was with the general physicians, and they would just...
We thought it was just waist pain. I did some
X-ray, and they said, "Oh, your X-ray result is okay." They just gave me some pain relievers. I kept going until I was advised to see. When I started having numbness in my leg, I was now advised to see a neurologist. So it was the neurologist that now advised that I should do the MRI test. So that was. So what I will say to people who have back pain, seek deep
medical
opinion, not just because actually some doctors also take it for granted. They won't refer you to a neurologist to say, "Oh, this pain could be connected to a neuro case." So that's the issue. So maybe I will say to doctors, if patients continue, complain of continuous back pain, they should quickly refer to a neuro specialist to have a second opinion. NMC, I would say your services is top class.
Yeah.
Top class services, top class.
Everything is perfect.
Everybody is, they bring the food from the cleaners, they clean the rooms.
Yeah.
They change the beddings. The nurses are super friendly. The doctors. In fact, when I was telling my wife that when I entered the theater, that men seeing the equipment in the theater, you just get well. Men when you see the equipment in the theater, you just get well. I was just telling her, so NMC is a top class. Even though actually I did a check on NMC too before even I did a check to see the rating of the hospital and also feedbacks, comments of people who have, and it was okay. It was, all the comments were quite okay, and the rating of the hospital is, I think, about the first 10 in UAE. So I don't know whether you've got to the top, but I'm sure if I were to rate, I would say it should be the first 5.
We are always in contact with our doctors from Nigeria and other African countries through mail, WhatsApp. They can mail us their queries, whatever queries they have, and we are always ready to answer. We'll be much more than happy to answer. And not just that, even if these doctors, they want to come here to see what kind of facilities we provide, what kind of surgeries we do, and the techniques we use, and even if they can learn something new from us, we'll be more than happy to do that. Okay, we'll be more than happy to see that they can learn something new and take it back home so that they can improve the facilities or the services they provide to their patients back home in Nigeria and other African countries. And the international patient care team in the NMC will be always happy to arrange such things and measures, okay, that will help both of us in long term.